Am I healing normally at 9.5 weeks post-surgery for full incisional upper blepharoplasty? I have gotten full incisional double eyelid surgery, removing fat skin and also taking in the inner corners slightly, and it has been 9.5 weeks. I'm worried that my eyes are healing too slow, and the crease on the inner corners are forming abnormally. I still experience a stinging pain on the inner corners and the scars occasionally. Are my eyes still considered swollen? Will my crease look more natural and become lower over time? And are my inner corner creases forming abnormally?
Thank you for your question. You have submitted several very good photos of different views of your eyes up close with your eyes closed. And you are 9.5 weeks after undergoing Asian eyelid surgery in which skin and fat was removed, and you also state that you had some work done on the inner corners, typically what we refer to as epicanthoplasty. And you are asking, is this normal healing, and is there anything to be concerned about as you review where you are in the stage that you're at? Well, I can certainly give you some guidance about how you are healing. I'm a little bit of background here. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I do a lot of Asian eyelid surgery in my practice. It's actually an area of specialty of mine, both primary and revisional surgery. So I can certainly give you a little bit of understanding as to how I explain this type of procedure to my patients and what to expect over the several months to a year after surgery. To begin with, based on the photos you have submitted and without any physical examination, I think that the overall appearance looks consistent with incisional surgery and the type of work that you had done. I think that that's something to get out of the way from the beginning, that everything does look from the photos like normal healing. Now, to understand what normal healing is, you have to take into account what is unique about Asian eyelid surgery. Well, to begin with Asian eyelid surgery, whether it's incisional or non-incisional, there is one critical element that has to be part of that surgery. And that critical element is a connection between the skin and a muscle that's underneath the skin of the eyelid called the levator muscle. This is a muscle that lifts your eyelid. When you try to create a crease, you're basically creating a connection. Now, in your situation, your doctor decided, because of an indication, because of probably extra skin and the presence of fat, to do an incisional approach. When that surgery is done, the skin is stitched to the underlying muscle, and what you are seeing is some of the redness and swelling that is typical in a little bit over 2 months after surgery. I always explain to patients who are having Asian eyelid surgery that that space between the eyelid crease and the margin can really collect a lot of fluid, and that fluid can create the impression of this crease being higher. It can be a little bit challenging to see that the pace in which the fluid is going away, but it actually is very much typical. I always tell my patients that you can expect swelling to be present up to a year. Now, it doesn't mean the same level of swelling. There is an improvement as time goes on. But even at 3 months, you could have a significant amount swelling, so that you really have to wait out until that swelling goes down before you see the final result. Typically, I'd say it's about 6 months, at which point you can say that this is likely the more stable appearance of the eyes. And even though sometimes people will linger with fluid, especially people who have sinus issues or allergies, that's likely to be the time when you can pretty reasonably conclude that you're where you should be. The same thing with epicanthoplasty. Epicanthoplasty is a repositioning of skin to reveal more of the space where the corner of the eyelid is. And so when you look at the skin, it's the fold over that inner corner, the inner canthus, is called an epicanthal fold. So with that, it's understood that there's going to be maybe a little bit of redness, a little bit of swelling. The skin can look a little bit thick, and it can look a little bit bumpy, but that also is very much normal. When you understand wound healing, there are several stages of wound healing, and the first month is it's what's called the proliferative stage. This is where the body is producing a lot of collagen, a lot of blood supply to deal with this controlled healing process or the controlled trauma of surgery. Beyond that, it goes through what's called the wound remodeling process. And that's when fluid diminishes, the collagen orientation becomes more what's called parallel, which means that the skin starts to get softer and flatter. And so when we see our patients, we re-educate them continuously about this process. So we see our patients at 1 week, 1 month, 3 months, 6 months, 12 months. And basically during those visits, we have that discussion to help people understand this. So this is important that you communicate continuously with your doctor, whether it's seeing the doctor at the office, and when you're at the office, make sure you bring a list of questions or whatever, or bring to their attention, of course, what concerns you, and get a sense of what to anticipate. It's routine for me during consultation to show examples of what the healing process is like so that people have a better understanding. I would say as a general rule, non-incisional swelling tends to last a lot less as long as incisional, but there are always exceptions to that. So discuss this with your doctor. From a collegial standpoint, I can say that it looks like you're healing as expected just based on photos alone. And make sure you follow your doctor's instructions and wait and see what the final result is. So I hope that was helpful. I wish you the best of luck, and thank you for your question.